Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. More than a week into administering second doses of COVID-19 vaccines, the Ekiti State government finds vaccine apathy among residents. Experts consider unique challenges of the pandemic in Africa and look for the way forward. And lockdowns around Europe ease gradually as the pace of COVID-19 vaccinations pick up. Last night, 8 states recorded 0 COVID-19 cases, while Ondo recorded the highest figure for a second day. An accumulation of cases were recorded in Bayelsa State between the 9th and 25th of February 2021. In the meantime, the Bayelsa State government has kicked off the second phase of the COVID-19 vaccinations. The head department of public health in the state also disclosed that COVID-19 testing is ongoing with an average of 30 to 50 tests done weekly. Let's take a look at the update.
The latest figures from the Nigeria Center for Disease Control, NCDC, shows 102 new infections reported from 9 states in the last 24 hours, the highest figure recorded so far this week. Again, Ondo topped the list with 68 cases. Bayelsa recorded 17. 5 cases were reported from Kaduna, while Lagos and Rivers had 3 cases each. 2 cases were reported from Akwa Ibom and Gombe, while Ebonyi and Oyo had 1 case each. According to the agency, there were 0 cases from FCT, Plateau, Nasarawa, Sokoto, Imo, Ekiti, Osun, and Ogun, and a backlog of data from Bayelsa recorded between February 9 to February 25, 2021. The latest tally has now increased the number of confirmed cases in Nigeria to 166,918. 69 more recoveries were recorded in the last 24 hours, raising the total number of discharged cases to 163,259. The fatality toll still stands at 2,117 as no new deaths were recorded. In Africa, more than 4.9 million cases and over 133,000 deaths have been reported on the continent. According to the Africa Center for Disease Control and Prevention, Nigeria has administered over 2 million vaccines of the first dose of AstraZeneca vaccine to its eligible population. As the second phase of the vaccination exercise picks up the pace across states in Nigeria, the health authorities are advising eligible persons who've taken the first dose to check their vaccination cards for the date scheduled to receive their second dose in order to gain full protection against the pandemic. Globally, more than 174 million confirmed cases have been reported from several countries, while the death toll has surpassed 3.7 million.
The administration of the second jab of the Oxford AstraZeneca vaccine for the first phase of COVID-19 is in progress in Ekiti State. The government says it has retrained and deployed teams across local government areas for the exercise. But the state government is worried that the rate of response is low, linking this to social media rumors, scares, and other factors. It, however, says it is following up on people who should complete their doses alongside other strategies put in place to address this new challenge.
The second one has started about more than a week ago. People have been responding, but the enthusiasm is not as it was in the first jab. The hesitancy is high, so we have not actually been able to cover as much as we would have loved to cover for now. People came up with different, decisions based on what they have read on social media. And what we are doing now is that we are trying to disabuse their mind that it wasn't the issue of what they actually read in their social media. So, and again, some people have even lost their card, and some people have traveled out of the environment where they actually collected the first jab. But by and large, the communication is on to actually make sure that people that have been, and many people even felt that one jab is enough for them. So they couldn't see any reason why they should come for the second jab. So, but we are making efforts to reach out to people that have gotten the first jab so that they will come for the second jab.
Human populations are growing and expanding into new geographic areas. As a result, more people live in close contact with wild and domestic animals, both livestock and pets. With the Earth experiencing changes in climate change and land use, such as deforestation and intensive farming practices, disruptions in environmental conditions and habitats can provide new opportunities for diseases to pass to animals and spread around the globe. But One Health seeks to promote a better outcome. Let's find out more. Dr. Nsabasi Ekanem is a public health consultant and pharmacist, and he joins us now via Zoom on the program. Thank you for joining us.
Thank you very much, and thank you for having me.
All right, tell us, how does the One Health approach work?
Okay, well, One Approach Health, simply put, is an approach that tries to bring together experts from human health, animal health, and plant health together with one table so that they can discuss on how to promote the well-being of humans, the well-being of animals, and of course, the environment. The COVID-19 pandemic has really shown us that there is a need for us to ensure that these three aspects of survival is really taken care of. From what we got, we've seen that COVID-19 came from animals. A zoonotic disease that jumped from one species to the other, and in this case, from animals to man. Now, had it been One Health strategy was so strengthened at that point, we would have been able to dictate COVID-19 even while in the animal species, and would have probably been able to survey and know that these particular pathogen or disease-causing agent has the capability of moving from animals to humans. And so One Health approach actually tries to bring all the experts from animal, human, and the environment together so that they can share information and they can, of course, interact together and monitor each of these species, whether it's plants, whether it's animal or human, so that when diseases that are capable of causing public health hazard is found in one species, it will be dictated and it will be eliminated before it moves to other species. So that is basically what One Health approach does.
But Dr. Ekanem, this coming because we have a pandemic such as COVID-19 before us, or, did this initiative come out before? What are the common One Health issues?
Okay, well, this is not the first time that we are discussing about One Health. You could remember that the last three pandemics that we've had, it moves from from animals to humans. We have the avian flu, the avian influenza. We had the Ebola. All right. We also had the Lassa fever. These all came from humans and was able to jump the species. So it came from animals and jumped the species to humans. So it is not because of COVID-19, but COVID-19 actually really underscored the need to a very large extent because this is affecting the entire world. But the concept of One Health is trying to bring everything in the human environment under one roof, so that we can care for the well-being of not just humans, but the environment. We are talking about climate change. It is still under One Health, because we understand that whatever happens to the environment will have a second-order effect on humans. For example, the climate change, we are seeing the effect that is having already in our environment. Deforestation is already having serious effects in terms of flooding. So what we are looking at in no less sense is how to protect not just humans, but the environment, from degradation and human animals, from deadly zoonotic diseases, knowing fully well that whatever affects whether the animals or plants or our environment will definitely have an effect on us. So that is the whole essence and the importance of One Health in our society.
So, successful public health interventions requiring cooperation of human, animal, environmental health partners. Plus,
Exactly.
we've had good initiatives in the past, and a lot of them yet to be implemented. So, essentially, how optimistic are you that this is a plan that will stick so that we can fight future epidemics, pandemics to come?
Yes, thank you very much. So we've seen commitment from a number of countries across the world. We've seen from US, we've seen from UK on how to holistically approach the entire human existence with the One Health approach. So the idea is that we want to bring everybody to one table. We want to bring experts in the animal health. We want to bring them to the table. We want to have, of course, experts on plant health and, of course, human health, so that we can better detect, because it will help us in disease surveillance. I mean, to survey the disease that have not even affected humans, but perhaps are found in animals, and they have the potential of crossing the species to humans. We are also looking at the issue of climate change. What will be the effects in the nearest future? So these are some of the things that we are also looking at in this One Health approach. We are also looking at the antibiotics. For example, antibiotics, how are they affecting humans? How are antibiotics used in animals, in animal husbandry? And what will be the ripple effect if this animal or this poultry is consumed by humans? So the whole approach here is to ensure that we check these things from the different aspects, whether in plants or in animals or environment. We make sure that we implement public health approach at that level to forestall, the catastrophic effect when it finally comes to humans. So I'm very positive. I'm very optimistic because I'm already seeing the approach and the commitment from a number of countries, and I hope that Nigeria will also lead the campaign in Africa.
All right, we appreciate your time. Thank you so much, Dr. Nsabase Ekanem, a public health consultant and pharmacist. Thank you for your expertise on the program.
Thank you for having me.
Well, over a year ago, the spread of COVID-19 changed life as we know it. And while borders were closed, travel restricted, regions were hit hard. But Africa was also not spared from the pandemic. The virus laid bare the continent's structural vulnerabilities, creating new setbacks for human development. Well, this next report seeks to build a more sustainable and self-reliant future post-COVID-19.
Africa accounts for about 3% of the global cases of COVID-19 as at May 2021, unevenly spread across the continent, with the northern and southern parts hardest hit.
We also have Professor Adamu, who is
to discuss the impact of COVID-19 on the African continent and its path to recovery. Thought leaders at the Mo Ibrahim Foundation Governance Weekend 2021 gather at a virtual meeting for this conversation. The director of the Africa CDC says clearly the pandemic in Africa is a puzzle.
We absolutely know that many more people than the 4.8 million reported have been exposed to the virus. Our own serologic surveys conducted within Africa CDC among several countries speak to that effect. We've seen studies conducted in Nigeria that speak to that effect. In Lagos, for example, about 20% of the population there have actually been exposed to COVID.
Throughout the pandemic, many have asked the questions: how did it happen? Why weren't countries prepared? And why are countries still experiencing devastation? The former Liberian Prime Minister, Ellen Johnson Sirleaf, attempts to answer some of these questions and the key lessons from the pandemic.
Stop transmission of the current virus. This requires immediate action, such as vaccines redistribution, provided in an equitable manner worthwhile. Second, transform the international system of pandemic preparedness and response.
With the challenge of COVID-19 attempting to undermine the fight against Africa's most lethal diseases such as malaria, HIV and AIDS, among others, strengthening African health capacity should be a priority.
We must build that capacity, not only for COVID-19 vaccines, but for other vaccines and medical products. The private sector will be essential in this effort. The pandemic has also underlined why it's so important to invest in universal health coverage based on primary health care and strong community engagement.
With the belated vaccine rollout starting last in Africa, it appears herd immunity will be far-fetched for the continent until at least 2023.
Still ahead on the program, we find out how the Ugandan government is fighting to avoid exhausting available bed space and oxygen supply in hospitals. Please stay with us. Welcome back. The Hong Kong team behind celebrity humanoid robot Sophia is launching a new prototype, Grace, targeted at the healthcare market and designed to interact with the elderly and those isolated by the coronavirus pandemic. Dressed in a blue nurse's uniform, Grace has Asian features, collar-length brown hair, and a thermal camera in her chest to take your temperature and measure your responsiveness. She uses artificial intelligence to diagnose a patient and can speak English, Mandarin, and Cantonese. Grace's resemblance to a healthcare professional and capacity for social interaction is aimed at relieving the burden of frontline hospital staff overwhelmed during the pandemic. This is according to the founder, David Hansen. Awakening Health intends to mass-produce a better version of Grace by August, said David Lake, chief executive of the joint venture between Hansen Robotics and Singularity Studio, with plans to fully deploy her next year in locations including Hong Kong, mainland China, Japan, and Korea.
So we designed Grace to look professional in a healthcare setting. So that would mean so that she would resemble the sort of human-like appearance of healthcare staff. And so then this would facilitate more natural interactions. A human-like appearance facilitates trust and facilitates natural engagement because we're wired for human face-to-face interactions. That's just the way human beings are. And so giving her a face that would be familiar to people, comforting to people, and also language abilities that are comforting. So we now have Mandarin and Cantonese capabilities for the Grace and Sophia robot platforms. Hey Grace, why don't you look at my face, thank you, and I'm going to show you a smile, and let's see what your smile looks like. Okay, yeah, look, or sad. Oh yes, reacting a little sad if I feel pain, and then maybe like imagine a big loud noise happens, bam. So with the Grace robot, we are simulating over 48 major muscles in the face. So we have 36 motors in the face. They're reversible, which means that each motor can simulate 2 muscles, because human muscles require 2 for the actions. Like my eyebrow is going up and down, kind of. So that's actually 2 motor groups, but it's in her it's just 1 motor.
Hello, Grace. Welcome to the world. Well, back in Africa, Uganda's President Yoweri Museveni reimposed a strict lockdown this week in the country that included the closure of schools and the suspension of inter-district travel to help beat back a surge in COVID-19 cases in the East African country. Uganda implemented one of Africa's tightest lockdowns at the beginning of the pandemic more than a year ago, but it was gradually lifted as cases slowed to a trickle. Mr. Emmanuel Anebiona, Uganda Ministry of Health spokesperson, joins us now on the program via Zoom. We'd like to thank you for joining us on the program. Dr. Anebiona, if you're there, please unmute your mic. We'll try to sort some of those issues very shortly. But let's go back to indeed our headline, and that is lockdowns in Europe easing gradually as the pace of COVID-19 vaccinations pick up. Now, over in France, from the 9th of June, the nighttime curfew has been pushed back from 9 to 11. Restaurants, cafes and bars can start serving customers indoors with 50% capacity, also a maximum of 6 people per table. We also understand that museums, cinemas, sports venues and non-essential shops can increase capacity. Also, from the 30th of June, according to the current plan, restrictions and the curfew will end. Well, from France to Germany, they've been on the lockdown since November. Measures are now being eased. Restrictions remain tighter in high infection rate areas. Now, medical grade masks are compulsory in shops and public transport. Now, outdoor terraces and restaurants, museums and open air concerts have also reopened. Some regions, such as the western state of Rhineland-Palatinate, have also opened restaurants indoors in areas where the infection rate is below 50 new infections per 100,000 inhabitants. German children in the 12 to 15 age group can now get vaccinated with the Pfizer-BioNTech jab. Well, over in Italy, restaurants and bars are open for indoor service, maximum 4 people unless from same household. Sport venues there open up from 25% of capacity. And the curfew from midnight to be scrapped entirely, but this will take effect on the 21st of June. Now, these are some of the updates. Over in Greece, people need to show for entry to cinemas there, museums, hairdressers or indoor dining. The government is letting tourists from many countries enter if they have been vaccinated or provide a negative coronavirus tests. Greece says masks are mandatory in public places. Bars, restaurants are open, 6 per table. Beaches are open as well, but with physical distancing, and museums and also outdoor archaeological sites are open as well. Well, about 30,000 nurses in New Zealand walked off their jobs in a nationwide 8-hour strike after negotiations with the government for better pay and working conditions failed. The strike action came after the New Zealand Nurses Organisation, NZNO, rejected a 1.4% pay hike proposed by the District Health Board earlier this week. The government says the nurses' demands amounted to a 17% increase that it can afford, but pledged to continue negotiations. Thousands of nurses marched on the streets holding placards, while others gathered at parks and outside hospitals around the country. Nurses have complained of being underpaid and burnt out, with conditions worsening with the arrival of the COVID-19 pandemic. All non-urgent surgeries and outpatient clinics were cancelled.
Please acknowledge us for what we're worth.
It's not something that just happened because of COVID-19. It's a chronic problem. Way before I became a nurse.
We want it. We work hard. We need better pay. Yay!
Well, public settings, including businesses and marketplaces, should ensure adherence to public health and safety measures as we continue to take responsibility and be part of the solution. Visit our website for more updates, a better understanding of the pandemic. You can find other stories there, breaking news, all at your fingertips. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.